So there are two reasons for the uptick in measles. The first is that there's a lot of measles around the world, and that was probably set back by lack of access to vaccinations, particularly in the pediatric population during COVID.
Mhm.
And then number two, there's a lot of increasing vaccine hesitancy in the United States. So if you look at the average, it doesn't look terrible. I mean, we went and dipped below 95% at the kindergarten MMR vaccines. But if you look at some communities like those in Texas where the measles outbreak is really at its full force, and some areas of New Mexico and Oklahoma, some of those vaccine rates are in the 70s or 80%. And you
Mhm.
really need 95% to really protect the community from measles. So some of it is, again, pandemic repercussion, but a lot of it is people's own decisions not to vaccinate their kids, um, and therefore putting the community at risk.
Yeah, absolutely. And I read an interesting article that talked about COVID causing an uptick in vaccine skepticism overall. What would you say to that? Did we actually become more skeptical of vaccines as we saw that perhaps COVID vaccines were not as effective as we thought that they might be?
I think the movement towards vaccine hesitancy and skepticism started even before COVID. And what COVID did was catalyze that movement. And there was some things that happened during COVID. Of course, people couldn't get vaccines easily. So when you had to think about vaccines like for whooping cough or pertussis, you require multiple vaccines and also other vaccines to require multiple visits. So that got set back. But I think what was more important was that people heard that, we should vaccinate everybody. And then they saw that COVID wasn't that impactful in children versus older adults, but it was still impactful. It was one of the top 10 causes of death um, earlier in the pandemic for children. And then they said, well, maybe kids are not susceptible to anything. And then the third observation, of course, was that the vaccine is great at preventing serious disease, hospitalization, and death for COVID, but not for infection. And that was discouraging to a lot of people because early in the pandemic, we had thought that if you vaccinated more than 95% of the population, you could develop some sort of herd immunity. What we didn't
Right.
bank on was that the virus was very wily and shape-shifting and changed over time because we were basing our models on vaccines like measles, which is an amazing vaccine. And but the repercussions of all of that is to, take what we were discouraged about with COVID vaccines and extend it to other vaccines like influenza in children, like MMR, and future vaccines. So we talked about these diseases being infectious, but vaccine hesitancy is also infectious.
Interesting. This might be a little bit of a bonehead question, Dr. Chin Hong, but given that it's the same vaccine, right? MMR, measles, mumps, rubella, are we going to also see upticks in mumps and rubella cases, or is that a little bit far-fetched?
Well, mumps is less common than measles is and less transmissible. So
Okay.
we will see an uptick in mumps, but not in the same scale as measles, which is probably the most infectious pathogen that we know, or one of the most infectious pathogens that we know. So it kind of exploits the holes or the fractures in our system most effectively. Um, so that's, how measles and mumps are different. And with rubella, there is a way in which we could have a salvation for rubella, which is the fact that we also screen pregnant people for rubella to prevent transmission to the uh, newborn, because it can cause birth defects. And, that is a way that you can probably try to pick up and prevent cases. But again, all of this requires trust and a well-oiled system. And of course, we know that not everybody has access to prenatal care or health care. Um, so those are the worries.
So, there's been this sort of scoffing of the severity of measles, right? People dismissing it as just a rash, when in fact, is it 1 out of every 1,000 kids that die from measles infections? Is that about right?
Yes, so when you look at where we were in the United States before the measles vaccine started, we had about I believe 500 deaths or so a year,
Mhm.
and about 1,000 people were disabled. So it's not um, only the deaths, and then every death is tragic, but it's also the consequences. There's also a long measles version, like long COVID, where you can get um, brain disease even after you recovered from measles. It's very rare, but these are all other things you can get apart from the rash, and that's why measles is not a walk in the park. Um, Many more kids get hospitalized, as we're seeing now in Texas, than those who die. And the fact that 2 people have died suggests that there's actually a lot more measles in the community. Because, like you mentioned, what is known as about 1 per 1,000 or maybe 2 per 1,000 die. So if you already have two deaths, that means that there are probably about more than 1,000 cases in the community that haven't been diagnosed.
Yeah. And do you suspect that there's an undercount of cases as we see with other diseases?
Yes, because there are only some venues in which disease is reported. If you have a homeschool kid, for example, there's a high chance that if that child gets measles, it's not going to be officially reported if the child is recovering at home. So it probably is an undercount. And that's why we're seeing the numbers get updated all the time, apart from people who don't know they're infected going to other communities and spreading it to unvaccinated and under-vaccinated individuals.
Yeah, and just to take a step backwards, were all the cases identified thus far, have they all been unvaccinated children?
As far as we know, or status unknown, which I take as unvaccinated as well, there were 5 people who were vaccinated, but they had only received 1 dose. But that's
Okay,
5 out of more than 200 cases.
okay.
And still, nobody who has received 2 doses. And we know that even if you receive 1 dose, it's about 93% effective.
Wow. Okay. Interesting. So 50 states currently have vaccine mandates in place to attend K through 12 education. Do you see some pushback on this happening given our current anti-vaccine environment in many places?
Yes, so it's more sneaky than that. You don't even have to see legislation saying vaccines are voluntary for everyone, which is a real possibility. But even if it's mandated, what you have happening, like in Texas, where it's mandated, is that you can have a exemption for philosophical or religious beliefs. California also had less strict laws, but what happened in California is that in 2014 we had the outbreak in Disneyland of measles,
Right.
where people went to multiple states and to other communities in California, and then it exposed where they were under and unvaccinated communities. And California got very, very strict with not giving as many exemptions for measles since then. But all states are not like that. In Texas, in particular, um, many of the people who got measles had exemptions, even though it was mandated, and many others were homeschooled as well, in which there's no mandate for a vaccine.
Yeah. So 2 days ago, the NIH announced that funding had been cut for research and vaccine hesitancy. Can you discuss that a little bit? What does that do to discourage the spread of measles?
I think it results in several outcomes. The first is that we wouldn't understand some of the reasons why people may not want to get vaccines. We may not understand what are some of the best evidence-based strategies to improve vaccinations. it will result in more people probably getting illness like measles because they're not being vaccinated, because we're not really intervening appropriately. And most of all, it sends a symbolic message that vaccinations or understanding why people don't get them are not an important priority for any um, health administration or
Mhm.
agency.
And related to that, USAID provided vaccinations to kids around the world. Given that it's been severely cut, are you expecting to see global outbreaks of measles?
Well, it's already happening. It's just going to get worse. And it's really foolhardy to think that it's an us versus them problem. Infectious diseases knows no borders. In fact, the vast majority of measles in the United States have been acquired from abroad.
Mm.
So to cut efforts abroad is only going to come back to hurt us and haunt us later on. Um, that's true not only for measles, but other diseases like tuberculosis, and even HIV, because it's really a intersection of all of these factors that allow more infectious diseases to flourish. And because we are a global community and because we travel a lot, we will increasingly become exposed to all of these pathogens in our normal, tourist.
Dr. Chin Hung, can we debunk a few of HHS Secretary Kennedy's statements, if you wouldn't mind?
Yes.
So first of all, is there a link between measles and autism?
No, that's been conclusively disproven. And in fact, doing more studies on these older vaccine safety only sows more doubt in people's mind. Like you don't have enough evidence. And I think the scientific community and the medical community is really unanimous in not thinking that there's a link between um, vaccines and autism, particularly MMR and autism.
Kennedy spoke about the benefits of cod liver oil in as an effective treatment for measles. What would you say to that?
I think that's been conflated with some of the evidence globally where vitamin A can help with some of the complications of measles, like blindness. And a
Mm-hmm.
lot of the reasons why some kids may have complications is because of poor nutrition. But there's no evidence that any of the kids in the United States have very similar issues. So there's no treatment for measles. And the only way to control measles is prevention. Um, so uh, the answer is no. There's no evidence that vitamin A or cod liver oil treats measles.
Yeah, he had also talked about a poor diet, characterizing Texas as a food desert. Is there a correlation between a poor diet and the increased lethality, for lack of a better word, of an infection?
Yes, there's a correlation between nutrition and multiple infectious diseases, um, you know, like Mpox, for example, um, and the deaths we've seen in kids in sub-Saharan Africa. But it's extreme malnutrition. It's just not, an American diet. Even
Mhm.
though there may be pockets of of food insecurity in the United States, it's not really at the same scale. And the scale of the outbreak right now in Texas is not is really linked to not being vaccinated and not to nutrition.
Interesting. Um, could you explain the whole natural immunity phenomenon that many people are talking about now? And is that a theory that also needs to be debunked? And then,
Yeah, so what people talk about when they say natural immunity is that I intentionally or I get measles or chickenpox, for example, and it gives me protection for life, which is true. I mean, acquiring infection uh, sometimes naturally, like smallpox or even Mpox, chickenpox. and measles can give you immunity for a very, very long time, if not lifelong. But the
Right.
problem is all of the consequences that we talked about. You can't predict who's going to die. You can't predict who's going to be hospitalized. You can't predict who's going to get blind or brain infection. Um, and that thinking when you have an effective vaccine is very, very dangerous. That's the whole reason we live in a modern era where we are lucky to have these tools available so we don't have to play measles roulette and figure out who's going to get hospitalized or get a brain infection or die, um, because it's not really predictable. So if I had a chance between exposing my kids to measles or chickenpox or getting the vaccine, 1,000,000% I would say getting the vaccine.
Absolutely. Is there anything you'd like to add before we cut off?
Um, I'm just trying to think. Um, oh yeah, the other consequence, of course, of getting sick with measles is not only the hospitalization, the potential death, the brain infection, it's the staying home part and out of school and work. And we know what keeping kids away from school already does. Um, so, it's up to a 3-week incubation period for measles. And then after that, you can be infectious for several days after the rash. So usually people stay home.
Yeah. Dr. Chinhong, are there certain communities that are more vulnerable to getting more harsher infections of measles? Are there underlying factors, environmental or genetic factors that make certain people more vulnerable?
That's a great question. Not that I know of that's really that powerful. There may be certain predisposing factors. You know that being immune compromised in general reduces your response to vaccines. So that might be more of the issue rather than the immune compromised state itself or certain other characteristics. But in general, the equation for measles is pretty straightforward. You either get the vaccine or not. Um, and quibbling about vitamin A or cod liver oil or nutrition status is really just, you know, the frosting on the cake, but the cake itself is really the vaccine.
Well, thank you so much. I really appreciate you taking the time.
You're welcome.
All right. You take care.
You too. Bye.
Bye.